Are you a woman in your 40s or 50s? Have you been feeling moody, exhausted and overwhelmed lately? Are you experiencing hot flashes and night sweats? If so, you may be going through menopause. This informative video explains the signs and symptoms of menopause so that you can better understand what is happening to your body. Hot flushes. Hot flushes are a common symptom of menopause. They are sudden waves of heat that can cause discomfort or embarrassment, typically lasting between 1 and 5 minutes. Hot flushes happen when the body's internal thermostat is thrown off balance by changing levels of hormones. This can lead to feelings of intense heat and sweating, rapid heart rate, headache, chills, and redness in the face or neck area. These episodes can occur at any time during menopause and come on suddenly without warning. Managing hot flushes can be difficult as there is no single cure for them. However, there are various ways to help reduce their frequency and intensity. Keeping cool with lightweight clothing is essential during this time to help regulate body temperature. Likewise, avoiding spicy foods or alcohol may also reduce symptoms since these products increase body heat. Additionally, staying active through regular exercise has been linked to reducing hot flush episodes, which suggests increased blood flow may provide some relief from uncomfortable sensations associated with these attacks. Finally, relaxation techniques such as meditation or yoga have been reported as effective methods for helping cope with hot flushes, although further research is needed to confirm this hypothesis and improve management effectiveness in all cases. Sleep disruption. Sleep disruption is an extremely common symptom of menopause. Many women report having difficulty falling asleep or staying asleep during this period of their life due to fluctuating hormones and other physiological changes. Additionally, hot flashes can occur at night, making it difficult to stay cool enough for a full night's rest. These hormonal fluctuations also often lead to low levels of progesterone, which can affect the production of melatonin and lead to further sleep disruptions. Furthermore, psychological symptoms such as anxiety and depression can also contribute to insomnia in menopausal women. Stressful life events that may occur around this time, such as empty nest syndrome or career transitions, can also disrupt normal sleep patterns. To combat these problems, lifestyle modifications such as regular exercise, avoiding caffeine late in the day and creating a calming bedtime routine may help alleviate some symptoms of sleep disruption associated with menopause. Vaginal dryness. Vaginal dryness is a common symptom of menopause. The symptoms of vaginal dryness can range from mild discomfort to severe pain during intercourse. Other symptoms include itching, burning, and a feeling of tightness in the vagina. These can all be very uncomfortable and difficult to cope with. There are several treatments available for vaginal dryness caused by menopause. Hormone replacement therapy, HRT, or estrogen tablets are the most common treatments prescribed by doctors to relieve these symptoms. HRT replaces the hormones that are naturally lost during menopause, helping to restore lubrication in the vagina and reduce any discomfort associated with it. Estrogen tablets help increase circulation within the vagina, allowing more moisture to accumulate there and reducing any associated pain or discomfort. Non-hormonal treatments such as moisturizers or lubricants may also be used in addition to these other therapies if desired by the patient. Changes in libido. Libido can be impacted by menopause in a variety of ways. As hormone levels fluctuate, libido changes can occur, which may include an increase or decrease in desire for sex and intimacy. Estrogen, testosterone, and progesterone all play a role in libido, with lower levels of these hormones sometimes leading to reduced libido. In addition to hormonal changes, physical conditions such as vaginal dryness brought on by menopause may affect sexual interest or pleasure. Other factors like stress and relationship dynamics can also influence one's sex drive during this period of transition. Fortunately, there are lifestyle adjustments that can help manage libido fluctuations, such as eating healthily, exercising regularly, and getting adequate rest. Hair loss or thinning. Hair loss and thinning are common issues faced by menopausal women. During menopause, hormone levels drop significantly, resulting in a disruption of the body's normal hair growth cycle. This can lead to decreased hair production, which can cause thinning or bald patches. Additionally, Higher levels of stress hormones due to menopause can also contribute to increased shedding and breakage of existing hairs, leading to further hair loss or thinning. Fortunately, there are a variety of treatments available for postmenopausal women looking to address their hair loss and thinning issues. Lifestyle changes such as reducing stress levels through meditation or yoga and maintaining a balanced nutritional diet may aid in preventing further hair loss or thinning associated with menopause. Joint stiffness, aches and pains. Joint stiffness, aches and pains are common menopausal symptoms. These symptoms can range from mild to severe, depending on the individual's hormone levels, physical activity, and lifestyle factors such as diet. Menopause-related joint stiffness is often more pronounced in the morning when you first wake up or after sitting for a long period of time. Other times that may be affected by joint pain include periods of hormonal flux or right before your period arrives. Joint stiffness during menopause can also be accompanied by other musculoskeletal issues such as muscle spasms and cramps. These can be particularly bothersome if they occur while sleeping or at night, waking you up from restful sleep patterns. Additionally, some women experience chronic fatigue due to an imbalance in their hormones, which then leads to further discomfort throughout the day due to sore muscles and joints from lack of movement. Treatment options for this include exercise, stretching regimens specific for symptom relief, as well as mindfulness practices like yoga to help ease any tension accumulative over time from stressful situations both internally and externally experienced during this transitional phase in life. Palpitations. Palpitations are a common medical symptom that can be caused by numerous factors. They occur when the heart rate or rhythm is abnormally fast, slow, or irregular. This causes an uncomfortable sensation that can range from a fluttering feeling to a pounding in the chest. Palpitations can be due to physical activity, stress and anxiety, medication side effects, caffeine intake, and more serious health conditions such as arrhythmias or heart disease. Although palpitations may cause some discomfort, they typically do not last long and should not be cause for alarm. If palpitations become frequent or severe, it is important to seek medical advice to determine if there is an underlying condition causing them. Increase in facial hair. The hormonal fluctuations of menopause can cause an increase in facial hair growth. As estrogen levels decline, testosterone levels can remain relatively unchanged, leading to the growth of facial hair. This is especially true for women who have polycystic ovarian syndrome, a condition where the body produces too much androgen hormones such as testosterone. These higher levels of testosterone can lead to increased facial hair growth on the upper lip, chin, and sideburns. Tinnitus. Tinnitus is a common menopause symptom, which refers to a persistent ringing, buzzing, or humming sound in the ears even when there is no external noise. It can be caused by hormonal imbalances related to menopause such as decreased estrogen levels. Women who have been through menopause are more likely than younger women to experience tinnitus for longer periods of time and at higher intensities due to changes in their hormonal balance. Additionally, thinning of the bones around the middle ear, changes in blood circulation, and age-related hearing loss can all contribute to tinnitus during this life stage. Treating tinnitus associated with menopause generally involves managing its underlying causes, such as hormone imbalances and other medical conditions like high blood pressure or diabetes. Treatments may include lifestyle modifications, such as reducing stress, hormone therapy if needed, and medications that suppress anxiety or depression symptoms that may be associated with tinnitus. Loss of self-confidence. Menopause can trigger a feeling of loss of self-confidence for many women. Hormonal changes can cause physical symptoms such as hot flashes, night sweats, and fatigue, which can all lead to a lack of energy, motivation, and self-esteem. The unpredictable nature of these symptoms can make daily life more challenging and make it difficult to remain positive and confident in one's own capabilities. This sense of diminished confidence can manifest itself through poor body image issues, which may lead to decreased interest in sex or intimacy. It is also common for women to experience mood swings during menopause that further contribute to this lack of confidence. Anxiety levels are often heightened during this period due to the hormonal fluctuations, leading to feelings of insecurity or uncertainty about the future. To combat these effects on self-confidence, seeking support from family members or health professionals is highly recommended for managing symptoms related to menopause. Additionally, lifestyle modifications such as eating healthy food, exercising regularly, maintaining a routine sleep schedule and reducing stress are all important components in preserving someone's self-confidence throughout menopause. Recurrent urinary tract infections. Recurrent urinary tract infections, UTIs, are a common complaint among menopausal women. This is due to the thinning of the urethral lining, which makes it easier for bacteria to enter and cause infection. Additionally, hormonal changes can lead to an imbalance of estrogen and other hormones in the body, causing further disruption of normal bladder functions. Symptoms of UTIs include frequent urination, burning sensation while urinating, strong-smelling urine, cloudy or bloody urine, lower abdominal pain and pressure. Headaches or migraines. One common symptom during menopause is an increase in headaches and migraines. Hormone shifts are believed to play a role in the cause of these headaches and migraines. Women often report experiencing frequent or persistent headaches that may last anywhere from minutes to days at a time. Migraine headaches can also become more frequent during this time due to the changing hormone levels. Some women may even find that their migraines tend to worsen when they experience hormonal fluctuations such as those associated with menopause. To help manage these types of headache or migraine symptoms, it's important to monitor your hormone levels and keep track of any triggers that may be causing them so they can be avoided if possible. Mood swings. Mood swings during menopause can be caused by fluctuating hormone levels and other physical effects which occur during this time. During perimenopause, the transition to menopause, the body begins to produce less estrogen and progesterone. This can cause a range of emotional symptoms including irritability, depression, sadness, and anxiety. Women may find themselves feeling overwhelmed or stressed as their hormones change in response to these fluctuations. In addition to hormonal changes, physical symptoms such as hot flashes, night sweats, and sleep disturbances can contribute to mood swings. Changes in weight can also affect emotions. Sudden weight gain from water retention or decreased activity due to waning energy levels can lead to feelings of frustration or low self-esteem which can impact overall moods. Reduced bone mass. During menopause, many women experience changes in their bodies, including a decrease in bone mass. This can have serious implications for bone health and lead to an increased risk of fractures later in life. Research has found that during menopause the estrogen levels in women's bodies decline sharply, leading to an accelerated rate of bone loss. This can cause bones to become weak and brittle over time, increasing the risk of osteoporosis and other bone-related conditions as well as fractures from minor falls or injuries. It is important for all women going through menopause to be aware of how this process might affect their bones so they can take steps to protect them from long-term damage. Thanks for watching. If you liked this video, make sure to subscribe for more.